I graduated as an optometrist, and I realized that I didn't want to be working in practice 9 to 5 every day. I wanted to pretty much see how optometry was practiced in other parts of the world. And I am from Kenya, and I used to go back to Kenya every year. There's an eye camp which is carried out every year. So I gathered a group of optometrists from the UK, and we went to Kenya. And at that point, we were just refracting patients and providing glasses. And I realized that that wasn't the best approach as such, because there was lots of questions in my mind as to whether what we were doing was actually benefiting the country. There were so many questions about, was it just a small plaster on a very big wound? So this led me to embark on a course in development management through the Open University, which kind of talked about issues like sustainability, human resource development, and I had the opportunity to participate in a research trip, which was training nurses and teachers to screen children in Nicaragua. And at that point, that was my first exposure to sustainable optometry practice, which then led me to do some work for the Brian Holden Vision Institute in Guyana, where I met Professor Kervin Naidu, who then introduced me to Professor James Lochman, who was leading the Mozambique Eye Care Project. He offered me a studentship for doing a PhD out in Mozambique, evaluating the competences of the existing eye care personnel out there. So my PhD involved actually looking at what eye care provision was out in Mozambique. Now, Mozambique is a very poor country with very few resources, which meant there were very few people providing eye care. So my work was then all concentrating on evaluating what was actually there and what was needed for future provision of eye care services. You've got to see what provision there is. Who do you have working on the ground? Who do people go to when they first have an eye care problem? Who do they refer to when the problem is more complex? Who treats them? Is there any surgical capacity? What's the healthcare system like? In Mozambique, the only level was what was called an ophthalmic technician. And even most of them did not know how to refract. So if someone couldn't see, very rarely would they actually be able to have glasses for that. So we couldn't just take a framework from the UK and say it's going to work in Mozambique, because the situation's so different. When they graduate, they have no supervision in the country. So you need to make sure that they're okay to work without supervision. They've got no equipment, so you've got to make sure they're okay to work with minimal equipment. So it was all making it very responsive to the needs of the people in the country at that point. The Mozambique Eye Care Project is training optometrists at a university in the north of Mozambique. The fact that there are now optometrists now working in all the provinces means that there is provision of basic eye care services. In 2014, there was 28 optometrists. The Vision 2020 targets want about 500 personnel who are trained in refraction for that country, for the population of that country. And there are nowhere close to that at the moment. There are graduates working in a lot of the provincial hospitals, and as more graduates come out, they'll be going out to more local hospitals as well. So we know that there is a capacity for people to actually get eye care in Mozambique.